So thank you for joining our webinar today. And welcome also to our webinar, The Revolution in Anti-Aging. And this webinar is organized by Kintaro Cells Power. A little bit information to you all that Kintaro Cells Power is a stem cell company that established since 2011 and already successfully performed 1,000 of treatment. So before that, let me introduce myself. My name is Dee, like Diana. So I will be assisting to you during this webinar. So our webinar today is a discussion about the current trend in anti-aging and regenerative medicine. And we so honor that we already have two professors in here. We have Professor Vladimir Baklasev and also Professor Sergey Kulemsin. So, hi, professors. It's really nice to meet you again.
Hello everyone.
Hello. Oh, hello. Hi. I like your background. Okay, so now before we really start our first presentation, I would like to remind to mute your mic during the presentation. And this webinar will be more or less like 1 hour. And if there are any question, you can submit your question in our Zoom chat, or you can make it also comment in our live channel YouTube. We will answer, don't worry, we will answer your question after finish the presentation session. There will be answer any question session. So without further ado, please, Professor Vladimir Baklasev, to your presentation. Just maybe give us some applause.
So, hello everyone once again, and let me briefly move you into amazing world of regenerative medicine and stem cell and regeneration, like how it occurs in nature. So, just a second. Here you can see our hospital. I am a chief scientific officer in Federal Medical Biological Agency in Russia. So it's about -2 in Moscow, and my warmest greetings from Moscow to your warm country. So I am a professor of medicine. I am author more than 90 publications, and some of them I will show you later. And let me start from the history of the story. You know, our story got a rather long history, and occasionally the story of mesenchymal stem cells started in Russia, or more correctly in Soviet Union, about 60, 70 years ago. So Professor Alexander Friedenstein, which was the, how to say, kind of student of Professor Alexander Maximov, because he worked in the same research field as Alexander Maximov, the discoverer who discovered stem cell, adult stem cell, hematopoietic stem cells. So Alexander Friedenstein, Soviet professor, Russian, he discovered mesenchymal stem cells. So, and firstly, he first published the characteristic of mesenchymal stem cells. It's a kind of amazing and universal tool, and all of us now studying it. And here you can see our current researchers, Professor Chalakhan, Professor Tkachuk, Professor Tkachuk is the head of Russian Society for Regenerative Medicine. And Professor Konoplyannikov, it's our professor. He worked in our hospital and he started mesenchymal stem cell therapy in our hospital. Here you can see me with my colleagues and with Professor Chalahian. He is also a patient of our hospital now for stem cell therapy. But let me start from the examples from nature. So here you can see axolotl. Axolotl is a master of regeneration. Axolotl can regenerate his limb or even his eye. If it destroyed, axolotl can regenerate de novo. It's amazing, and we all should do like axolotl. You see, you can use axolotl as your aim for human regeneration. Wow, and here another examples. Let me briefly do like this. Okay, here you can see regeneration of worms. You know, worms got a possibility for complete regeneration. So if you cut it into 3 pieces, it will be 3 new worms. And here is the regeneration from axolotl. So after amputation, some healing occurred and some growth started. It's very interesting thing that during this stage, some dedifferentiation occurred. So some differentiated cells started to be juvenile, you know, dedifferentiated, and then started to form early limb, then matured limb, and after that you can see adult normal limb. So there are 2 stages in this process: dedifferentiation, which is very interesting, how dedifferentiation is occurred and why human cannot start dedifferentiation. Probably we should help him. And another stage is a proliferation and differentiation. Just keep it in mind, and just amazing, just imagine, sorry, it's this amazing thing, you know, regeneration in human occurred every day. And every day in the body of an adult, about 1 kilo of cells are born and die. And during life, just it's fantastic. During life, about 20 to 30,000 kilos of cells are born and die. So what are the cell formation mechanisms? The first one is division from terminally differentiated cells. So blood cells, lymphocytes, fibroblasts, epithelial cells can be born up to division. And another way is differentiation from stem cells. So blood precursors differentiate from stem cells. And then the third way, the third option is reprogramming of differentiated cells. Unfortunately, this mechanism does not exist in human, but it should be. And let me later say some words about this mechanism. So what are mesenchymal stem cells? So you can see here, it's a kind of master regulator. It's a kind of master of regeneration. And mesenchymal stem cells produce all stromal cells like fibroblasts, myocytes, adipocytes, chondrocytes, osteocytes, and also mesenchymal stem cells regulate neural regeneration, blood formation, and also here we can add an immune system. Mesenchymal stem cells got a lot of anti-inflammatory cytokines. They can secrete them into the focus of inflammation, and also mesenchymal stem cells can migrate into the focus of inflammation or into the focus of damaged tissue. So it's a really amazing tool, as I already said, and it's an universal tool, either for holistic therapy and anti-aging, revitalization, and also for the specific treatment of inflammatory disease, of traumas, of disease of nervous system. And let me show it later. So how do stem cells work? Here you can see in these boxes, you can see known mechanisms and the mechanisms of working. You know, using cytokines and using lymphokines and other biologically active molecules, mesenchymal stem cells make immunocorrection and the balance between pro and anti-inflammatory cytokines. MSC also activate the nervous and endocrine system. They stimulate angiogenesis via hypoxia-induced factor and VEGF, vascular endothelial growth factor, which can be produced by mesenchymal stem cells in normal condition. Improvement of the metabolism, activation of own stem cells, it's a very important thing. And there are also of paracrine effects, the secretion of growth factor and other biologically active molecules, secretion of exosomes with microRNA. And you know, microRNA is another big type of epigenetic regulators. So they can regulate gene expression and a lot of other situation into cells. So mesenchymal stem cells can also secrete an extracellular matrix protein, and that's why we can use them for skin regeneration. And they also can make direct cell-to-cell communication via gap junctions. So in this video, I hope you can see the video here. You can see the behavior of cultivating mesenchymal stem cells on a glass surface. So you can see cell nuclear endoplasmatic reticulum, and you can see a lot of intercellular contacts, which always is making and destroying simultaneously. And here you can see the cell division. So we got a lot of tools for investigation of mesenchymal stem cells, and we use fluorescent microscopy. Here you can see a kind of intracellular machinery. So these are microtubules, and these are lungs of the cell. These are mitochondria. You can see it in fluorescent microscopy. So, and in this movie, you can see cell division. It's a gift from my colleagues from Nikon, because I'm using microscope system from Nikon. So they gifted me this amazing video, so you can see cell division. In our hospital, we studied the biodistribution of mesenchymal stem cells. Here you can see that after intravenous injection, the majority of mesenchymal stem cells go to the lung system. It's very well known, because after intravenous injection, all cells go to the small blood circulation, small blood circle into pulmonary veins and pulmonary arteries first. So that's why we can use mesenchymal stem cells for lung repair, and I'll show you how to do it, especially how to do it during COVID-19 pandemic. It's a special tool for using of mesenchymal stem cells, and there are a lot of evidence worldwide that mesenchymal stem cells can treat COVID-19 pneumonias. So the next stage is how to produce mesenchymal stem cells, and why we should produce mesenchymal stem cells from allogenic, from young donor. not our own mesenchymal stem cell. Here you can see our GMP lab, and here is the GMP lab of our manufacturer partner. And just look through the volume and how to say, the quantity of isolators, and we can produce a lot of mesenchymal stem cells here. So, but let me answer the question, why should we use allogenic mesenchymal stem cells? You know, if you took a young donor and an old donor, for instance, 65 years old, and took bone marrow from them, excuse me, уйди, дверь закрой. Excuse me, there are some kids. So if we took mesenchymal stem cells from young donor and from old donor, it will be different mesenchymal stem cells. So senescent cells produced some another markers, and they got different regenerative potential. And look to this diagram. Here is the ratio of mesenchymal stem cells in bone marrow. And you see in the biggest quantity of mesenchymal stem cells in newborns. You can see the ratio 1 to 10,000 cells. So one mesenchymal stem cell, multipotent stem cell, per 10,000 of other cells. And if you look through these, you can see a decrease of mesenchymal stem cells ratio during aging. And in teens, it's only one cell per 100,000. In 30 years old adult, it's one cell per 250,000, and in adult 80 years old person, you can see only one stem cells per 2 millions. So there is no sense to use bone marrow or other fat tissue or other tissues from adult ones, because they consist, they don't have mesenchymal stem cells, multipotent stem cells, which can improve regeneration. That's why we, in our research, we are using mesenchymal stem cells from young donors from 18 to 25 years old. And we also use placental-derived stem cells. And in my opinion, placental-derived stem cells is the best choice for regenerative treatment. Of course, we should characterize mesenchymal stem cells to protect their regenerative abilities. Here you can see an expression of markers and MSC markers in cultivated mesenchymal stem cells. So you can see that these cells are CD34 negative, CD45 also negative, CD19 negative, positive, and CD29, CD44, and CD73, and CD90, as I said, positive. It's very important characteristic, because if you change something in cultivating media, in condition, in physical-chemical condition or something like this, you can lose the regenerative ability of mesenchymal stem cells. So it will be not non-regenerative cell therapy, but we have to do regenerative cell therapy. And each series of mesenchymal stem cells tested by a multipotency. And here you can see the result of multipotency testing. Multipotency means that these cells can differentiate into adipogenic, osteogenic, and chondrogenic directions. So this is a characteristic of the best mesenchymal stem cells, which we produce. Another important thing is the safety of cells. During cultivating, cells can collect some mutations, and that's why it's obligate. It should be obligate, and we do it obligately. We test karyotype of mesenchymal stem cells, both bone marrow derived and placenta derived. So here you can see the normal karyotype. And now let me briefly talk about what kind of diseases we can treat using mesenchymal stem cells. As these cells are stromal cells, we can use it for wound reparation. And here you can see the result of burning wounds, which could be completely healed using mesenchymal stem cells. And here is, we collaborate with some biomedical and biofabrication companies, and there are a lot of products like skin graft using collagen matrix and other kind of matrix, hyaluronic acid matrix, hitosan, etc. So it's a very big direction of using mesenchymal stem cells. And our team also got a patent for application of bone marrow mesenchymal stem cells in the radiation therapy. You know, FMBA, it's a kind of specific medical care for atomic industry. So we use mesenchymal stem cells for such pathology. Here you can see anti-aging application. So there are two main tools for anti-aging treatment. First one is so-called nanofat, but if you combine nanofat with mesenchymal stem cells, the results are much better. The same way is treatment for alopecia. Non-implant technique for breast enlargement using mesenchymal stem cell with fat grafting. But the pivotal candidates for regenerative therapy, of course, it's an incurable disease like stroke, and it's a very big field of using mesenchymal stem cells for stroke treatment. Parkinson's disease and other neurodegenerative disease, and also spinal cord injury. And we got in our hospital a lot of clinical trial for critical limb ischemia, for idiopathic pulmonary fibrosis, for spinal cord injury, and for stroke. Of course, we collaborate with experimental laboratories, with CRO, which made a lot of experimental research of mesenchymal stem cells and their safety and their efficacy. Here you can see the results of Moscow State University. They use a mice model of critical limb ischemia. So they just make occlusion of femoral artery, and after 20 days, you can see necrosis in control group. But if you inject mesenchymal stem cells in this limb, ischemic limb, you can see lack of necrosis and you can see revascularization. That's why we registered our first clinical trial with using allogenic mesenchymal stem cell for the critical limb ischemia in patients. Here is our clinicaltrial.gov identifier, and let me briefly show you the results. So you know that critical limb ischemia is a very incurable disease with a very high rate of amputation. So we can use, here you can see there is a scintigraphy. So this leg is okay, microvasculature is okay, and this leg is completely ischemic. And we used mesenchymal stem cells. We treated mesenchymal stem cells with ischemic legs. This is the situation before, and here is the situation after. And we completely, or almost completely, restored the vasculature of ischemic limbs after mesenchymal stem cell treatment. Currently, the total amount of patients is 16, and the improvement of clinical status obtained in all patients, and in 80% of patients, we escaped amputation. It's a very good result, just believe me. And here is some results of combined treatment with local MSC injection and revascularization using surgery, using xenograft, artificial vessel graft. Another direction is MSC for idiopathic pulmonary fibrosis. So I'm just a little bit pressed in time. Let me just show you our paper. It was published in 2019 in Stem Cell Translational Medicine. Professor Aviryanov is our head of our pulmonology department, and our team, you can see. So first in human high cumulative dose stem cell therapy in idiopathic pulmonary fibrosis with rapid lung function decline. We also characterized MSC, and we have shown that in 20 patients in main group, we improved lung capacity, DLCO gas function, and we improved walking distance. Here is the result of 6-minute walking distance tests. And you can see after 12 months, the control group cannot walk at all. And in the main group, in 20 patients, we obtained very good result. And here you can see some CT dynamics after stem cell therapy. And let me show you COVID-19. It will be brief right now, but if the audience interested in COVID-19, I can prepare a specific webinar devoted COVID-19. So our hospital now is working with COVID-19. Our hospital is divided into red and green zones, and here you can see CT picture of severe COVID-19. So we used firstly we saw and we read the publication from our Chinese colleagues, and they used MSC treatment in 5 critical ill patients with acute respiratory distress system. And you see after the MSC treatment, they demonstrated an improvement of lung function. And it's very, very good because, you know, as I said, we injected intravenously MSC and they all moved to the lungs. And here is our own results. We tried in some patient, in some severe patient, and also obtained improvement of lung function. And currently we participating in multi-central clinical trial sponsored by Generium. It's a Russian biotechnological company, our industry partner, and we will treat a big amount of COVID-19 patients. Ischemic stroke, very briefly, we made experimental studies using ischemic stroke model and obtained that in rat model of ischemic stroke, we can use intra-arterial transplantation, and we obtained reducing a stroke scale, modified stroke scale. And the most important thing that we demonstrated decreasing of cerebral infarct volume after mesenchymal stem cell treatment. And here is a, sorry for Russian language, here is the clinical case of young girl, 30 years old, with stroke in pons, stroke in brainstem. It's a very severe disease, and she was completely paralyzed. She can only move her, how to say, eyes. And she was completely paralyzed. We used stem cell treatment in her case, and now she can sit, she can move her hands, she can smile. It's my greetings to Kintaro Cells Power, because I thought to talk about, to say some words about diabetes, but currently Kintaro Cells Power got the best experience in diabetes than our hospital. So if you're interested in diabetes, you can just ask them. What's the future prospects of stem cell therapy? I and my colleagues are completely sure that the future prospects will move into the manufacturing, mass production of stem cells using bioreactors and using 3D cultivating systems like this. And here you can see microscopic scanning electron microscopy of 3D system for MSC cultivating. And another future prospects is modifying of stem cell. So if we need to treat, for instance, ischemic critical limb ischemia, ischemic conditions, we can use MSC producing VEGF or IGF or other growth factor. If we need to move MSC better into inflammatory region, we can produce MSC overexpressing SDF alpha, so the chemokine ligand. So, and another prospect is using of exosomes, using exosomes in such big bioreactors, completely automatized, and it will provide very cheap and very high quality stem cell products. So here is the end of my presentation, and just for aesthetic purpose, I would like to show you some pictures from fluorescent microscopy from our laboratory. So here you can see brain with neuron with transplanted mesenchymal stem cells, and here you can see some cell products which are studying in vitro. Here are some stem cells. Here you can see microtubules. Here you can see directly reprogrammed neural stem cells obtained from mesenchymal-like cells. It's a patent of our collaborator from Canada. We are collaborating in the field of treatment of spinal cord injury. Unfortunately, I have no time to tell you about it. So, and in the end of my presentation, kindly see some snow. You know, it's snowy in Moscow. Very nice pictures I got in Malaysia. There were never snow. And here you can see some Russian people in Moscow. You know, now it's a very difficult time in Moscow. And this is my I try to say some good words about our people who are against the corruption, in the way how I can do it using the time of my webinar. So thank you very much. Thank you for your attention.
Thank you, Professor. It's really quite interesting, really. And we already have some question here. Okay, this is from Mr. Manoj. I have a friend who is suffering from a rare neurological disease called corticobasal degeneration. Is that
cortical degeneration? Cortical nuclear degeneration. Yeah.
Is it the stem cells can help?
It's a difficult question, you know, talking about neurodegeneration at all, like cortical basal temporal degeneration and some other primary progressive degenerations, I'm not sure that mesenchymal stem cells is the best way to treat it. But anyway, we tried stem cell therapy with in collaboration with our European colleagues. We tried to treat temporal degeneration, you know, and there were some good results, not too much, but we tried just to decrease the rate of progression of these primarily progressive disease, you know, like in ALS, like in some other progressive disease. It's very difficult. And you know, in using a stroke, it's not progressive degeneration. You know, stroke, it's a catastrophe, and after the catastrophe, it's a very good. We can make very good situation for regeneration. So in stroke, mesenchymal stem cells are much more effective than in progressive neurodegenerations.
Okay, so it could be. Thank you also, Mr. Manoj. Okay, so maybe we can go into our next presentation. And thank you, Professor Vladimir. Thank you for your time.
Thank you.
Really nice.
Thank you. Bye bye.
Okay, there's Professor Sergi.
Okay, nice to meet you.
Nice to meet you. Okay, please.
Okay, so I'm not a medical doctor. I work in the field of cellular and molecular biology. And let me tell you some stuff about how stem cell works. What's the mechanisms and what the idea of stem cells. So I will swiftly fly through these 4 topics: stem cell secretome, exosomes, iPS cells, and stem cells and CAR T cells. So let's see. Okay, so as already mentioned, Vladimir Baklaushev, mesenchymal stem cells secrete a lot of really interesting stuff. First of all, it's cytokines. Cytokines are biologically active molecules that could affect different tissues and cells in organism in various ways. Also, it's RNA and exosomes. So what about cytokines? What's good from cytokines? Here I place a long list of cytokines that are secreted by bone marrow derived MSC, like Vladimir Baklaushev used, or like Intero cells power used. So this list is just to scare you. We won't, observe all of these cytokines. I just want to show you that MSC, it's a real factory of tons of different cytokines that affect tissues and cells in a really interesting way. Let's take a close look for some of these cytokines. First of all, it's VEGF. It's vascular endothelial growth factor. Professor Baklaushev already mentioned this cytokine, this molecule. It's really interesting, and it's really critical for vasculogenesis. Also, this molecule could be critical for rehabilitation after heart attack, stroke. Also, this molecule is necessary for muscle growth. So whenever our organism needs to grow new endothelial, need to produce some new blood vessels, our organism will definitely use VEGF. So if we use mesenchymal stem cells that are producing VEGF, we could stimulate this process in our organism in this way. And here you could see their molecular structure of this protein. It's really interesting molecule. Another very interesting molecule for use in our organism is transforming growth factor beta. This molecule that are also secreted by mesenchymal stem cells is powerful immune suppressive cytokine. So why do we need immune suppressive cytokines at all? Because in all, ads in the TV and internet, information about diseases and COVID-19, we see that we need to boost our immunity. We need to make our immunity stronger and stronger. But you see, in some cases, our immunity is too strong, and our immunity could destruct our own organism. For example, in COVID-19, we are not suffering from the virus itself. We are suffering because our immune system destroy our own lungs. So the problem with COVID-19 is the overactivation of our immune system. So with the help of transforming growth factor beta, we could downregulate the activity of our immune system and prevent, for example, lung injury in COVID-19. If you're interested in COVID-19 related questions, we could arrange a special webinar on this topic. Also, it could be complications, for example, from therapy, from transplantation of bone marrow derived hematopoietic stem cells. And for therapy of these diseases, it could be so-called graft versus host disease, transforming growth factor beta that are secreted with mesenchymal stem cells could also be really profitable. Also, therapy of different autoimmune diseases, like, for example, Crohn's disease or array mesenchymal stem cells that are secreting transforming growth factor beta would also work really well. In some countries, for example, in Japan, there are commercially available products only for therapy of GVHD based on mesenchymal stem cells. Another really impressive molecule that are secreted by mesenchymal stem cells is the brain-derived neurotrophic factor. It's a small and really simple protein that stimulates growth and differentiation of neurons and synapses on neurons. What is interesting about this molecule? It's not only stimulate growth and differentiation of neurons, but it also supports existing neurons. So not only people with damaged brain needs BDNF, but also all of us needs BDNF to support quality of our neural system. So this molecule is really interesting for anti-aging therapy because all of us could have really helpful support from BDNF for all of our neural system. This molecule could support our neurons and preserve it from degradation and other age-related problems. So this molecule is generally good for neuroregeneration. Really interesting question for me, for example, is why not to use this cytokine directly? So okay, we see that these cytokines is good for therapy of different diseases. So why don't we just isolate these cytokines and use it as a pure drug? For example, why not we use pure TGF-beta? Why don't we inject intravenously TGF-beta for patient with COVID-19? And the answer is that systemic use, organism-wide use of these cytokines often is not effective at all, because mesenchymal stem cells would serve as vehicle for delivery of these cytokines directly to the tissue where these cytokines is really necessary. So, for example, for therapy of COVID-19, mesenchymal stem cells could apply doses of TGF-beta directly for cells of immune system in the lungs, and could downregulate immune system only in lungs without downregulation of immune system in other tissues. Also, for VEGF, with systemic application of VEGF, we could have some not beneficial effects like endoteliosis in eye. But if we use mesenchymal stem cells, then this factor will be delivered only in tissues with inflammatory diseases where we have to perform some revascularization. So all these cytokines that I have mentioned are not effective. Clinical trials showed that these cytokines are not effective for therapy if we use these cytokines as the pure drugs, but they are really good for therapy of different diseases when these cytokines are secreted by mesenchymal stem cells. So it's really, naturally delivered cytokines. Okay, what's new and what interesting from mesenchymal stem cell is so-called exosomes. And what is exosomes? Exosomes, it's basically magic bubbles. It's tiny structures that are produced by cells, and these structures, it's look-alike cells themselves. So what is basically inside exosome? We see here some nucleic acids, some metabolites, amino acids, interesting proteins, and also some surface proteins. So exosome, it's like a small piece of cell that could move from one cell to another and could transfer a lot of proteins and useful molecules from one tissue or from one cell to another tissue. What is really interesting and amazing in exosomes is that due to their tiny size, exosomes have another biodistribution. So not in every place of your organism mesenchymal stem cells could be delivered, because cells have some dimensions, and they are couldn't, for example, transfer through brain-blood barrier. But as for exosomes, the size of this vehicle is much smaller, and they could be delivered in different compartments of our organism and could help restore activity on different tissues across organs. Vladimir Baklaushev mentioned that there is interesting object in regenerative medicine is IPS. What is IPS? It's induced pluripotent stem cells. Is basically just mysterious cells that were discovered by Shinya Yamanaka. What's the idea of induced pluripotent stem cells? In adult organism, it's we can't find a really good number of pluripotent stem cells, but with reprogramming factors, we could make IPS, we could make pluripotent stem cells from other type of cells. Let's say we took skin fibroblast from patient, then with some genetic mechanisms, we put reprogramming factors like OCT4, SOX2, CMYC, other, and then this fibroblast turns into pluripotent stem cells. So it turns into dedifferentiated cells. And then we could differentiate these induced pluripotent stem cells in any type of cells. For example, let's imagine patient that suffered from disorders related with pancreatic cells. We could take piece of skin of this patient, make iPS cells, so make pluripotent stem cells, ex vivo, we could make these cells in tube in laboratory, and then we could differentiate these cells into pancreatic cells and put it back into this patient. So we basically, with technology of pluripotent stem cells, we can make any cell from any cell. We can make any cell of human organism from any somatic cell of this organism. So what's the problem with these iPS cells? So why don't we use these cells for any application? You know, why can't we go to the hospital right now and ask for iPS therapy? The problem of iPS cells is that these cells are really associated with the risk of cancer, because if you make these induced pluripotent stem cells, then these cells they differentiated too much, and then you are not absolutely sure that genetic material of this cell is okay. So as for now, iPS cells are not in use anywhere, and we have to rely on other sources of stem cells. For example, like mesenchymal stem cells, which are absolutely safe. Another topic that I would like to cover is stem cells and CAR T-cell therapy. CAR T-cell therapy is really interesting part of therapy of number of diseases, and potentially also for anti-aging. CAR T-cell therapy works in next way. First of all, you remove blood from a patient to get T cells. Then you reprogram these T cells with some genetic material. For example, you could do it with lentiviral vectors. Then you grow millions of these genetically modified CAR T cells that could now detect and destroy cancer cells organism-wise. And then you infuse these CAR T cells back into patient. And in patient, these CAR T cells could detect cancer cells and destroy cancer cells. So it's like cure that you make from the patient cells to treat patient in next generation way, to treat patients with genetically modified cells of this patient itself. As a way of obtaining these CAR T cells, you could use not only CAR T cells from these patients, but you could also use stem cell derived differentiated CAR T cells. So let's summarize what's the biology of MSC and what's good from MSC. MSC produce number of different molecules, exosomes, and RNA. And all this healthy stuff from MSC could transfer in your organism directly to the tissues where it needed. And in these tissues, all these MSC related molecules could support survival of cells, could support regeneration, reduce death of cells, and also age-related death of cells, support angiogenic effect for tissues where you need revascularization, and also really nice and interesting feature of MSC is anti-inflammatory effect. So if we have a chronic inflammation, and it's really tough to treat chronic inflammation in a lot of cases for a lot of patients. then MSC could be of use for chronic inflammation treatment. Okay, I would be glad to answer your question.
Okay. Wow. Thank you so much, Professor. So we still have maybe some question. Okay. So feel free, anyone that maybe asking from the presentation or any thoughts after looking all the presentation, asking something.
Sure. We could discuss any question, even if these questions are not closely related to my presentation.
Okay. Maybe okay, there's one from Tatiana. Is MSC is safe for everyone?
Well, to my knowledge, MSC is absolutely safe for usage in most of the cases. Of course, you should consult your physician to decide whether is there any condition that would be, beneficial for MSC treatment, and is there any condition that could be, not good for MSC treatment. I'm not sure about a patient with blood cancer because in patient with blood cancer, it could be some immune-related, stuff that is not good for MSC treatment. But in most cases, MSC is really beneficial for therapy.
Okay, so it's safe. Mostly is safe. Okay, so is there any question again or any thought after this? Because this is the limited times. You can directly send to us by email, and we'll be back to you if there's any question or thought, or maybe you can visit our website. Maybe you can see on my background here. So I guess it's a wrap. Thank you so much, Professor. Thank you, Professor Sergey. Thank you, Professor Vladimir, for today, for your have some with us today. Thank you so much. And thank you also to all participants in here. Thank you. And if you still want to keep up for our next webinar, you can follow our Instagram in Kintaro Cells, or visit also to our website. And we have also the Facebook, Kintaro Cells Power International, and our website is kintarocells.com. If you forget, you can see here. And really, if you have any thought again or question, you can directly send us email, and we'll be answering and back to you. Okay, so thank you for today. Thank you for all participants, and we'll see you again on our next webinar. So
Okay.
thank you.
Thank you.